Go.
Hi, my name is Alexandra Carpenter, and I'm going to set a primary IV on my patient. I've just received orders from Mr. Jackson saying that he needs 1 gram of Rosefin today. His white blood count was a little high when we received his labs back. So what I do have available is Rosefin at 500 milligrams per 1 milliliter. So what I'm going to do when I make my calculations, I figure 1,000 mg's over 500 times 1, which is 2 mLs. So I have that there. And then what Rosefin is, it is to treat and fight bacteria. And the recommended dose is 1 to 2 grams once daily. Side effects are GI upset, and the more severe ones are Stevens-Johnson's disease and possibly anaphylaxis due to allergies with penicillin or milk protein or keftin. So what I'm going to check to see if there is any allergies, also to see if any other lab results would contraindicate what me administering Rosefin. Okay, and then I am going to get my equipment together. I'm going to wash my hands, don my gloves, and I'm going to get my Rosefin ready first. Which again, it's 2 mLs. I'm going to make sure everything is intact, all my packaging is in date, there's nothing soiled, everything's sealed the way it's supposed to. I'm going to wipe my bottles. Okay, I'm going to pull in 2 mLs of air, inject that into my Rosefin, and then I'm going to pull out 2 mLs, withdraw 2 mLs of the drug. Okay, I'm going to recap using the scoop method. I got my 2 mLs. Okay, now I'm going to get my saline for my flush. Okay, I got a 10 ml syringe, and I'm going to draw up 6 mLs of air, inject that into my bottle.
I'm recording your butt. What are you doing? Oh, okay.
My 6
That's
mLs.
good. So it's in there. Okay. Just wanted to make sure.
Are you resolving it in
There.
Oh, yeah. Oh, okay.
Put my needle in the sharps container. I'm using a needleless port
Alright, now
here.
it's your turn.
Okay. There we go. Got those taken care of. And now I'm getting my IV bag, my mini bag, which is 15 mLs with a drop factor of 10. So when I figure out what my drops per minute is going to be, I'm going to take my 50 mLs over 30 minutes and times it by 10, which will be 17 drops per minute. I'm going to go ahead and infuse my medication, which is the Rosefin.
Clean.
I'm going to clean my port. Go ahead and inject it. Okay, take that out, put it into the sharps bag or box. Okay, mix it. We're good. Going to label my bag with the patient's name, date of birth, the time that I'm about to go and put it on, and the date and what type of medication, how much is in there, and the that's it. And then I'm also gonna label my tubing on my IV with the name, patient name, my initials, date, and time. Okay, so I'm going to take all my equipment into the room, as well as my doctor's orders. Knock, knock, knock. Hi, Mr. Jackson. My name is Alex, and I am going to be your nurse today. I am going to set up an IV for you. Also, in that IV, you will have Recepin, which is an antibiotic. It seems that your white blood cell count is indicating that you have an infection, so we need to get that under control. Do you have any questions? No? Okay. Before I had left the room where I was setting everything up, I would have taken my gloves off, washed my hands, and then now I'm going to wash my hands, put my gloves back on. But I'm going to check for any allergies. Do you have any allergies? No? And then also ask them for the name and date of birth. Okay, everything's good. How are you feeling today? You're doing okay? I'm going to assess his INT site. Everything looks good. There is no signs of inflammation or redness or phlebitis, so everything looks good. Do you have anything, any fistulas or any surgeries that would indicate a contraindication for even this to be there? No? Okay, good deal. Okay, so now I'm going to hang my bag. Prime it first, or spike it. Here we go. Which I would have cleaned that again just to make sure. Use aseptic technique. Hang this up. Prime my tubing. I'm making it fill up to halfway. There you go. Make sure it's all and clamp it so that I can prime my tube here and make sure there isn't any air bubbles. Yep, everything's good. I'm going to hang this here. Okay.
The gloves.
Now I'm going to go over to my INT and I am going to wipe it down. Aseptic technique. Unclamp as I am inserting my needleless port here with my saline. Okay, I'm going to inject about 3 mLs of my saline solution using the stop push method, stopping at every half mLs. Okay, I could even also aspirate just to make sure that INT is put in the correct place to begin with. Everything's good. Okay, gonna clamp it. And then take this off. How are you doing? You're doing okay? Okay. Now I'm going to take my IV tubing. I'm just going to go ahead and wipe this down just in case. And then put it in there. Connect it. Go back up here. Unclamp. And set my drop factor to that 17 drops per minute. There it is. So everything looks good. I'm going to take off my gloves, wash my hands. Or how are you doing there? Are you doing okay? Yes? Okay. Everything looks good as far as the INT is concerned. So I'm going to go back out without my gloves, of course, and then come back to check when it's supposed to be done. And I'm going to document what I did, put the patient's name, my initials, the medicine, the dose, route, frequency, the volume, the drop factor, and that whether or not the patient tolerated the procedure well. Okay, I'm back. Wash my hands. Put my gloves on. Hey, knock, knock, knock. Hey, how are you, Mr. Jackson? Everything good? Looks like you're done here, so I'm going to disconnect you. Okay? I'm going to clamp this off. Okay. Going to take this off. Clamp it as I'm trying to take it off. Okay, everything looks good still. Over here, take my IV medication off. Okay, I'm going to wipe my ports. Go ahead and unclamp as I am putting my syringe on. I'm going to aspirate to make sure everything's still good with the tubing. Yes, everything's good. So I'm going to put in the rest of my IV or my saline solution in there using the stop push method, stopping at every half milliliter. Okay, I pushed it all in. Going to clamp as I am taking this off. You doing okay? Good. I'm going to inspect my site here. Everything's good. No inflammation, no redness, and I'm going to give heparin if I have physician's orders to do so, just to make sure that there is no blood clotting at that site. Okay, you're doing okay? Okay, well, here's your call ballot. I will also check for the rest of the 4 Ps and give them some patient teaching. I'm going to take off my gloves, wash my hands, document everything that was done, the medication, dose, route, frequency, whether the patient, how the patient tolerated it, if there was any signs of allergy or anything like that, and then my drop factor, of course, and the time, date, everything. Okay, and that's it.